Kidney disease and kidney failure. What are the causes? I'm here to explain everything to you. Pay attention to this video. I don't watch Oklara's video more than 10 seconds. Do you know why? I usually feel emotional watching the videos. When I look at people, the conditions surrounding them and everything, I can't watch it more than 10 seconds. I usually swipe up immediately. Now, let's get into the business of today. The kidneys. When we talk about the kidneys, what are we talking about? The renal system. These are the two kidneys the ureter, the bladder, and the urethra. Two kidneys and two ureter, the bladder, and the urethra. Now, your kidneys work 24 hours in 24 hours. Now, what are the functions of the kidneys? There are many functions of the kidneys. Number one is filtration, cleansing. Whatever you eat, drink, everything will push to the kidneys, and the kidneys will filter them and determine what the body needs and what the body doesn't need. And whatever the body needs, it will keep them. And whatever the body doesn't need, it will push them out. And they will come out as urine. 2, your kidneys help in regulating blood pressure. Your kidneys help in the production of red blood cell. And then also for vitamins like vitamin D and so on. Today, we'll be focusing on the filtration. Now, it is expected that a healthy kidney, which is working 24 hours in 24 hours, should at least filter more than 90 mils per minute. More than 90 mils per minute. Now, in a situation that your kidneys are not able to filter up to this amount, something may be wrong with your kidneys. This is where we calculate what we call the EGFR. In the calculation of the EGFR, we use your age, your height, and your weight to calculate it. That is why it's very important when you come to the hospital, you tell us your real age. Now, we have different classes here, or different ranges. When the kidneys are not able to filter up to 90 mils per minute, it may be an indication that something is wrong with the kidneys, or something is wrong somewhere here. Now, what can make the kidneys not to filter up to this amount? Number one is what I call, what do you eat? What goes into your mouth? Number one, take it as the mouth. Under this mouth, we have food. We have drinks. We have medications. We have herbs, whatever it is that you are taking. Two, we have cosmetics, skincare included here. Bribery and corruption, influencers and ignorance. Now we have trauma, infection, untreated infection, education and awareness, health condition. Here we have hypertension and diabetes. First of all, let me explain why I wrote this with red biro. The two leading causes of kidney disease and kidney failure are hypertension and diabetes. Yes. So now you have known this one. This is not supposed to be the main problem that we are having. Our main problem is not here. Now, let's discuss it proper. First of all, what do you eat? What goes into your mouth? processed food, pizza, burger, shawarma. Those things are processed food, and processed food are toxic to the kidneys because of high content of sodium. Now, let's talk about seasoning cubes. Sauces, different colors, red, brown, dark brown, and black. And then what we normally see inside shawarma, sausages, yes. These are processed food, and they are high in sodium. And sodium is toxic to the kidneys, and which can now cause hypertension. And hypertension is a leading cause of kidney disease. There is no health benefit of seasoning cubes, shawarma, burger, pizza, no health benefit. They are all processed food. You see somebody preparing fried rice, you will add the one that is red, the one that is black, the one that is brown. Those things are high in sodium. And sodium causes high blood pressure. And that is why high BP is the leading cause of kidney disease. Have you seen why I wrote it here? Many of you are hypertensive, but you don't know. How would you know? I'm coming to that. Education and awareness. I'm coming to that. How would you know? So what do you eat? Why do you derive so much joy with seasoning cubes? There is no health benefit with seasoning cubes. Yes. There is no health benefit with all the sauces you put in your food. Stop looking at the food influencers on Instagram and Facebook. They are making money with those things. There is no health benefit with seasoning cubes and sauces. Nothing. All those things are high in sodium, and sodium causes hypertension, which is the leading cause of kidney disease. Quote me anywhere. There is no health benefit of seasoning cubes, and they know it. When was the last time you ate fruits and vegetables? Organic fruits and vegetables. When you go to a restaurant, instead of you to order a proper meal, you want to keep your table very tushed so you can take a big selfie, take videos. Chicken and chips from where? Which chicken? 2 weeks old chicken? Fries? These are processed food. They are not good to your kidneys and even your body entirely. What do you eat? Very important. Now we have GMOs in the market. I don't know. So many things. We preserve our food with insecticide. We don't wash them. So many things we are consuming. People don't pay attention. Instead of you to eat yam, organic yam, you prefer to eat noodles with the spices inside it, and you think it's luxury. What do you eat? What do you eat? Secondly, drinks. Alcohol. The one we call soft drinks. There is no health benefit of soft drink. Carbonated drinks. There is no health benefit of them. Instead of you to take that one, why not make zobo? If you want it to be sweet, then add dates. Everything that God wants us to eat, He hung them on the tree. If nature didn't make it, don't eat it. If you want to take orange juice, then squeeze orange. Blend it. Now, many of us have blenders. Blend it or juice it. If you want to have it in a white color or transparent color, then blend apple and add it lemon. What do you eat? What do you drink? Alcohol. Substandard alcohol. I heard that Azul is produced 100 per year, but only one restaurant in Nigeria will sell 100 in a night. How did we get here? So what do you eat? What do you drink? Drink water. Drink water. If you want orange juice, then blend orange. Juice orange and drink. Juice orange and carrot and drink. Then make zobo and drink. Put dates, add honey. Cosmetics. Now, before, there's what we call udake, palm kernel oil, and shea butter, coconut oil. People refuse applying them. It doesn't smell nice. How can? We see it as people who are broke. They are the ones using udake, or they are the ones using coconut oil. We embrace hydroquinone, mercury, in form of civilization, in form of, tush, what is running trend. Now we are battling with what we cannot even solve with what we have. Have you noticed that shea butter, coconut oil are the things that's more like active ingredients, right? In today's cosmetics, the things you abandon in their natural forms, that is what they are bringing now in, manufacturing them in organic form, and you are applying them. So the organic cream, we are talking organic cream. Who told you they are organic cream? They mix colors, so many things together in the name of organic cream. So except you are very sure who is supplying the organic cream and soap for you, then you can now say yes, you are using organic cream. Otherwise, watch out for that. Let us go to the main one. Medication. Some other substances, the drugs you take. Counterfeit medications. Substandard medications. This is where NAFDAC comes in. How did we get here? Even in the hospital, you can actually be given substandard medication in the hospital. It's not like it's not everywhere. Some of the medications you take are actually being produced at your backyard, but you don't know. People now are the cause of the problem we are having, and they are not even exempted. They are also being affected. But because everybody is just trying to make money by all means possible, we are endangering our lives. Go and buy paracetamol now. Put it in water or touch it. It will just melt. Some of them just have no effect. Don't even bother because it's well packaged. No. The people that are doing these substandard medications, they know what they are doing. And they will package it very well. They will package it very, very well. So yeah, don't look at the packaging to determine whether it is counterfeit or not. No. So medication, that is where our problem lies in. Self-prescribed medication. Some of us don't go to hospital. Anything, we go and buy antibiotics. I heard somebody saying, if you're a lady after your period, you should treat infection. Treat infection for what? Is your period a disease? Is your period infectious? Why should you drink antibiotics after your period? Why? It was actually an influencer that said this. I will tell you why I added influencer and ignorance here as one of the risk factors of kidney disease. I will tell you why I added influencer and ignorance here. So why are we taking medications when we are not sure of what is wrong with us? Why are we consuming over-the-counter medication? Painkillers, before I forget. Painkillers. The way we drink painkillers, we don't check. Continuous drinking of painkillers is what is damaging our kidneys. And people are coming down with renal failure. How did we get here? Can we tone down the rate at which we self-medicate? We are consuming so much painkillers. We are consuming so much painkillers. What goes into your mouth? Food, drinks, medication. These are the main problem because they are not regulated in Nigeria. Our agency is not doing enough work
to make sure that all these counterfeit medications are regulated. Let's talk about herbs. Herbs are actually good. The problem is that the moment you want to buy herbs from people and you're not very sure what they have added or what they mix together, that is where the problem comes in. Herbs are good. Ginger, garlic, turmeric, cinnamon, cloves, star anise, all of them, Eden fruit or whatever, they are good. When you are sure of what you are mixing, that is good. But the moment you are buying the liquid, you don't know what they mix together, you don't know the regulation, the quantity and everything. That is where the problem comes in. You can boil your ginger, garlic, turmeric drink. That is okay, perfect, no problem. Your star anise, your clove, okay, zobo, fine. But if you are buying it from outside, that is where the problem comes in. Because even zobo, people will make very good zobo and end up adding orange flavor, pineapple flavor, coke flavor, this one flavor. Those things, those sachets are toxic to the kidneys because they contain high sodium. So be the one to prepare your herbs and drink it. They are fine. But don't buy mixture from somebody. You cannot determine what is inside. You don't know what they mix together in form of herbs. I have discussed cosmetics. Now let's go to this. Very important. Bribery and corruption. I know you're wondering why I added bribery and corruption as risk factor for kidney disease. Let me tell you. Poor political will. In a country whereby the agency that's supposed to protect us, regulate our food, drinks, medication, drug, everything, are not working. System. When we have a bad government, people who are not interested in humanity, then this problem is bound to occur. Let us flash back to when we have Dora Akunyili in office. There is no day that you wouldn't hear about NAFDAC and the things they were doing. There was no day. He chased counterfeit medication and drugs out of Nigeria during her time in office. If the government is working, trust me, it's very easy for them to arrest everybody. During the time of Dora Akunyili, she was visiting Onitsha, Lagos, where they are producing this medication and selling them. Whistleblow. Trust me, the government is not working. Why I put bribery and corruption in a country where they are blowing money up and down? Humanity, healthcare is not the priority in Nigeria. You will know that through our budget. It's not a priority. All we know is borrowing money, right? Now we have introduced GMO into the system. So, bribery and corruption. Sometimes this money will be mapped out, right? But the reason why the money was mapped out will not be carried out. Whose responsibility it is to checkmate the production and distribution of food and services, food, drugs, medication, so many things. Whose responsibility it is to make sure that we are producing standard medications, food, drinks, everything that is going into the market are of good standard. Whose responsibility? Is the person or the agency doing it? That is the question. So this is why I added bribery and corruption. Corruption doesn't mean you eating the money. No. It means when you are not doing what you're supposed to do, that is corruption. Something may have been preventing you from doing it. That is corruption. Influencers and ignorance. Let me tell you why I added this. Now, if you go to especially Instagram, you will notice that most of our influencers, we are influencing different skincares, different drinks, different so many things. Now, let me tell you, some of these people are aware that some of the things they are influencing are not actually good. But because we are working so hard to get brand deals by all means possible, we just want to make the money. So many of us, even those who are educated, are informed, they are still putting our lives in danger by influencing the things that they are not supposed to influence. Some of them, when you ask them the questions about the things they are influencing, they cannot even answer you. Because the main idea or reason why they are influencing is just to make money and nothing more. Why I added ignorance is this. Somebody like me, you cannot influence me from buying what I don't want to buy or what I don't trust. So the ignorance of people who are not informed, because this is coming from their celebrity crush, someone that they trust so much. So, and with their sweet mouth, you begin to buy what is not even good for your health. The issue is that, do you see them eat what they advertise? Have you seen how they do advert for seasoning cubes? You see them cooking a cup of rice. I'm eating this, it's because of this. Are you telling me that the cup of rice is what they are going to feed their family? No, it's for that advert, for that video. That setting is for the video, and that is it. So ignorance, people don't know. They are not informed. So they are looking up to their influencers, their celebrity crushes and whatever to know what is good and what is not good. Unfortunately, these people are out here to make money and not to tell you the good things to buy and not to buy. Have you seen where the problem comes? So some of the skincare, drinks, so many things people buy due to influence, not because they know about it, but so many people have influenced them to buying that thing. So they are not buying it because they believe that it's good because their influencers have influenced or advertised that particular product. Are you seeing it now? We have trauma. When we talk about trauma is like maybe accident. It can be domestic accident. It can be road traffic accident. Anything that will, give trauma to the kidneys. Maybe mechanical trauma, puncture, or something like that. Yeah, that's will not damage the kidney. From there, you can have it. We now have infection. One of them is UTI, urinary tract infection, untreated infection. That is why whenever you have UTI, we always advise to treat it because you remember the diagram that I drew at the beginning of this lecture. You will notice that here now, when you see this thing now, this is the bladder. Any infection here, if not treated, will go up and affect the kidneys. So infection can actually be the cause of kidney failure. Yeah. So yeah. That is why sometimes we have acute kidney failure. Sometimes serious infection can just shut down the kidney or the kidneys if you don't act immediately. If from acute, it will be chronic kidney disease. Do you get it now? Yes. Now, education and awareness. Now, many people don't even know, not because that they don't want to obey the things that will benefit their lives, but they are not aware. They don't know the food that is good for the health, the kidneys, or whatever. So we are lacking here. The healthcare system is lacking here. Do I blame them? The healthcare system in Nigeria is in shambles. So yeah, we are lacking here. We need to educate people, at least be able to know this is good and this is not good and why it's good. So people are not even aware of what is good for their kidneys and what not good for their kidneys. So we talk about the health conditions. We have anemia here. Yeah, when you have anemia, it can actually shut down your organs. Yeah. Then we have endometriosis, which can actually block either the ureters or it will deposit on the kidneys and cause kidney disease. We also have cholesterol. When there is that deposit of the fats, that will now inhibit or alter or impede blood circulation to the kidneys, which in turn affect the kidney function. So yeah, so these are the risk factors of kidney disease. So now, what do we need to do? Is to be careful of what we put into our mouth, what we drink as food, as drink, or as medication. We need to be very careful. Pay good attention to yourselves. So these are the causes of kidney disease. Now, what do we do? What do we do? The government is not helping matter. They don't even care. Their focus is on next election, how to win the next election. That is their focus. Do we have the resources? That is why I said that we don't even have what it takes to take care of our kidneys. So the best thing to do is to preserve it. Preserve them. Oh yes, preserve them, because we don't have what it takes to care for the kidneys. Our healthcare system or healthcare services are not free. So we don't even have job, no nothing. We don't even have the food. We have the food, no money to buy them. We are now being supplied with GMOs. So we are like, how did we get here? And how do we get out from this spot?